I'm Dr. Charles Slomka, and I'm a gynecologist here at the PAPP Clinic. I've been in the Union area for 25 years, and I've practiced obstetrics and gynecology for almost 27 years now. I've now limited my practice just to gynecology, which is all of women's health except for deliveries. I do lots of laparoscopic surgery in the hospital, and in our office we now do the new procedures, the Essure for sterilization, the NovaSure for bleeding problems, and we do the LEAP procedures for taking care of precancerous lesions of the cervix. I grew up in Columbus, Georgia, and from there went to Georgia Tech for a couple of years and then joined the Navy. There are a lot of cliches when you ask somebody about why they became a doctor, but I wanted to do surgery, but I also wanted to deliver babies, and the only way to do both of those things was to go into obstetrics and gynecology. The Essure procedure that we do in the office here is a sterilization technique that gets rid of the hospital setting, and it's done under local anesthesia, and it's very simple and straightforward and works as well as any of the procedures that we used to do in the hospital. The NovaSure procedure also is done here in the office, and that's for bleeding problems. We again took this out of the hospital and made it much easier for the patient in and out of the office in just an hour or so, and the next day you're back at work and doing things that you would normally do. It helps to alleviate extra expenses because most insurances cover it as an office visit and not as a big deductible from the hospital. This is our loop electrical procedure machine, and with this machine we can cut out abnormal areas that are precancerous and can lead to cervical cancer. And as we know, cervical cancer is the #1 killer of women in the world, and in this country it's not quite as bad because we have pap smears, and most countries don't. Pap smears will pick up early cancer, and if it's found, this machine will take care of it. And it's done here in the office. It's done out of the hospital, so it's much cheaper for you, and it's much easier because you're in and out of here, and you can return back to work the next day without any complications. I have a Harley-Davidson Ultra Classic. It's a pretty big motorcycle, and it has lots of room to pack luggage and your clothing when you go on trips. And taking a trip on a motorcycle is really fantastic. Going across country, seeing all the different states and cities you go through in the countryside with all the animals and rolling hills is very unique, and a really close way to see the country, much nicer than in a car or a bus or an airplane. I'm Dr. Charles Slomka, and I am PAPP Clinic.